All right, let's dive into the essential framework for laparoscopic grasping and holding instruments. These tools are our direct link to the patient's anatomy. And really, mastering them is absolutely fundamental to any successful minimally invasive procedure.
I love this phrase. It's just perfect, isn't it? Because without that direct tactile feedback, these instruments literally become our hands. They're what give us the precise manipulation and retraction that really define advanced laparoscopic surgery.
Okay, so here's our game plan. We're going to start by really nailing down their core function. Then we'll build a clear framework for how to choose the right one. We'll get into the big distinction between atraumatic and traumatic tools, explore some key dissectors and other specialized instruments, and then wrap up with the critical principles of safe handling.
So let's start at the beginning. Function. What is the core purpose these instruments serve in every single case we do?
It's all about one thing: control. Think about it. Whether we're retracting the liver to get a good view of the hiatus, or providing some counter traction to open up a dissection plane, or just trying to stabilize tissue for suturing, these instruments are what allow us to do all of that with precision and stability, deep inside the abdomen.
So you look at the instrument tray, and there are dozens of options. How in the world do you choose the right one for the job? Well, the key is to have a mental framework, a classification system that helps you make effective and, most importantly, safe decisions right there in the middle of the operation.
And that framework, it really boils down to these three categories. First, you've got your atraumatic tools, for when preserving tissue is absolutely critical. Then you move to traumatic, for when you need a secure grip and it's non-negotiable. And finally, you've got the specialized toolkit for solving those unique surgical problems. Every choice you make fits into this logic.
Now, the most common decision you're going to make, case after case, is choosing between an atraumatic and a traumatic grasper. And the guiding principle here is so important. You have to match the instrument to the tissue's properties and to its ultimate fate. Is it staying in the body or is it coming out?
The classic example of an atraumatic tool is, of course, the Babcock. Its design, with those fenestrated, non-crushing jaws, is engineered to gently cradle structures. Think about handling bowel, or a fallopian tube, or ureter, anytime where minimizing pressure and preventing an accidental tear is the top priority.
And then you have the complete other end of the spectrum, the Alice grasper. Its fine, interlocking teeth are designed for one thing and one thing only: an unyielding grip. This is the trade-off, right? You use it on tough, fibrous tissue that's destined to be removed, like a dense fibroid, a lymph node packet, or the fundus of a really inflamed gallbladder that just keeps slipping away.
So here's the bottom line. The choice is dictated entirely by the tissue's destination and its delicacy. Are you preserving it? Then you have to use an atraumatic grasper, period. Are you removing it, and you need a rock-solid hold so you don't lose the specimen? That's when a traumatic grasper is not only appropriate, but often necessary.
Okay, so moving beyond just simple grasping and holding, now we get into the realm of instruments that are designed for more nuanced, more specific jobs, many of which kind of blend the ability to grasp with the ability to dissect.
The Maryland is probably the most common dissector in all of laparoscopy. It's a real workhorse. Its fine, curved jaws are just perfect for developing tissue planes bluntly, but it's also delicate enough to grab small vessels for coagulation. That versatility is why we use it all the time. Though, you have to remember, its grasping power is pretty limited for any kind of major retraction.
Then you've got the right-angle dissector. Its unique shape is its superpower. When you need to get behind a critical tubular structure, I'm talking about the cystic duct, the cystic artery, or even a major vessel like the renal artery. This is the tool that lets you create that plane with a degree of safety and precision that a straight instrument just can't match.
And honestly, this is just scratching the surface of the specialized toolkit. You've got retractors like the endoclinch, with its sharp points designed to get a secure grip on solid organs like the liver. You have super task-specific tools like stone-holding forceps for biliary cases. And there's a whole category of specimen retrievers designed for one critical job: getting tissue out safely and in one piece.
But here's the thing. It doesn't matter how advanced or specialized the instrument is. Its effectiveness depends entirely on the surgeon holding it. And that brings us to the universal principles of safe handling. This is a protocol that has to be second nature for every single action we take.
This safety protocol is absolutely non-negotiable. Number 1, match the grasper to the tissue, always, to prevent injury. 2, avoid excessive force. That ratchet is there for security, not to create a crush injury. 3, when you're using energy, always check the insulation integrity. An unseen stray energy burn to the bowel can be a catastrophe.
And number 4, keep the instrument tip in your field of view at all times. Unseen tips are what cause unintended damage.
So at the end of the day, mastering this toolkit is about so much more than just motor skills. It's about translating your surgical strategy into safe and effective action. It's about having precise, reliable, and predictable control inside the body, which is the very foundation of excellent patient outcomes.
And that brings us to the end. But I'll leave you with a question to think about. Beyond just the simple type of tissue you're handling, what other patient-specific factor, maybe something related to their inflammatory state or their previous surgeries, might fundamentally change your choice of grasper during a procedure? Definitely something to consider.